Thank you. Good morning. As Dr. Greenblatt said, I'm Dr. Marion McCrary, and I'm presenting my project, Creating the Stepping Stones to Engage Physicians Where They Are. I beat burnout, and I can teach you how to do that too. Through asking myself a series of simple but deep questions, I was able to become a master of my priorities by determining what was important to me and then making decisions based on that. I learned how to set boundaries. I changed my mindset and explored opportunities that were outside of my comfort zone. And I learned how to have fun in my job again. And I can teach you how to do that. And that was the purpose of this project. 5 years ago, I found myself being one of approximately 50% of internists in our country who had experienced burnout. Burnout is a triad of emotional exhaustion, disengagement, and decreased efficacy. And it leads to increased loss of physician lives through suicide, increased cost of healthcare because physicians are leaving practice early and leaving practice altogether, and it lowers patient satisfaction, compliance, and access. And addressing this issue of burnout is crucial to reaching this quadruple aim in healthcare, and that's better patient experience, better population health, decreased costs of healthcare, and increased physician satisfaction in their job. So ideas. I personally went through the process that I mentioned of determining priorities, setting boundaries, changing my mindset, and looking for opportunities of growth. I decided to do training as a health and wellness coach in addition to my MD degree, and I gained skills and experience in helping physicians and non-physicians really work through what they wanted to make change in their life, the change that they needed. Given all that, I found myself as the well-being champion for our North Carolina chapter of the ACP. And at our most recent meeting in February before COVID, I set up a booth, a wellness booth at our meeting, and invited our members to come over and have conversations about wellness. And I got crickets. It didn't help that my booth was all the way across the room from the bar, but it made me realize I needed to pivot and kind of change how I was addressing this approach. I really misjudged my audience. I thought they were more on the same level of interest in wellness that I was. And to use a sales and marketing term, they were a little bit more of a cold audience, and I needed to figure out a way to kind of warm them up. So I set about trying to decide how to figure out where they were and then to meet them where they were, figure out what their pain points were, what solutions that they needed, and try to go about it that way. So where are they? Most physicians who are feeling burnt out are just feeling overwhelmed. And to add another long list of things to learn about as part of a way to assess burnout or treat burnout really wasn't going to be helpful in this circumstance. So I decided to concentrate on giving them more bite-sized nuggets of information that they could consume in short amounts, or small amounts, excuse me. Physicians are also highly scheduled. And so having something that they could look at and learn from that was convenient and do on their time was key. I found out from our meeting that only about 10% of the internists in our chapter actually attend that annual meeting, at least last year or this year. And so that may be because of all those other priorities that they have, or the fact that they joined the ACP for things other than what the meeting was providing for the membership. And so I felt like that we could reach more of our membership, them plus the other 90%, by going virtual. And then COVID happened and we're all virtual. So we kind of fell into this as an option. And although physicians are scientists, we keep hearing that it's not very helpful to fill our slides full of lots and lots of data and just to read the slides as a script. It's more important to really discuss things as story-based or case-based. And often the first thing a physician feels or thinks when they start to experience burnout is, what did I do wrong? What's wrong with me? How did I get here? And there's a lot of guilt and shame associated with that at times. So actually hearing from a fellow physician who had gone through what they had gone through, discussing it in an authentic way, really is a great avenue for compassion and community. Hearing you're not the only one that this has happened to is so helpful. Hearing that it's not a personal failure, but really a chance for you to think about how to reframe what's going on in your life. Think of it as an alert or an alarm when you start to feel burned out. Just like your car tells you with a little ding that your gas is running low, that you need to put more fuel in the car, burnout's the same situation. Think of it as an invitation to really assess what you want in your life and how to get it, and to maybe unsubscribe from some of the things that you had been doing that may not be serving you well going into the future. And lastly, this topic is really important. We don't want to be learning about it just to passively take in information. It's really something that having practical, tangible, action-oriented, solution-oriented strategies is so important. We really want to know how to fix this. So now that I had a new approach, I was on the path to trying to get my audience, the other physicians in our community, what they needed. So I created a video series called Stepping Stones, A Practical Path to Well-Being and Finding Joy. And this was based in PowerPoint, and then I created videos by going through the slideshow. There are 10 videos altogether, and they total 70 minutes. The longest one is about 10 minutes. So again, getting back to that short, concise, convenient learning. And I based this on the American Medical Association's Steps Forward module on well-being. There are multiple modules in this series that help physicians find a way past burnout through personal changes as well as practice transformation. This particular module had 7 steps to well-being and joy. And they were first to get organized, then start to think about your physical state and your mental state. Connect socially. Find that meaning for yourself in and outside of work, and embrace joy. Find time to reflect and refine. So I use this framework and also the skills that I had as a health and wellness coach to supplement strategies in this module so that I could parlay these key messages in a motivational way. And I created my 5 stepping stones, and they were: manage the clutter in your mind, your emotions, and your day. Determine your priorities and what brings you meaning to your life. Think about reframing your thoughts to support that forward movement. Explore tangible ways to enhance that sense of meaning and well-being. And then practice a pause and pivot time to reflect and refine in different seasons of your life. The next few slides are examples of slides I used in the video series. Again, very minimal slides. The graphics were all drawn by me. It was actually a fun way to put some creativity into the project. Here's a second one. And the next one, you actually may hear me speaking in it, is an example of the video portion of it. The next thing I want you to do is take all of that stuff that you have. So how did I actually get the stepping stones out to the folks who needed it? I already mentioned how I recorded it. I was able to upload the videos to Vimeo, which is an online database that anyone can search out the videos. And I attached a survey link. So folks that were viewing the videos could give me feedback on the content, and I could adjust what needed to be known in the future. I sent this out in different ways to lots of individuals. So all of our North Carolina ACP members got a link to it in our wellness newsletter. North Carolina Medical Society members got a link to it if they were on the morning newsletter list. It was put on my social media accounts, a website that I have, and emailed to personal friends, professional colleagues who I thought might have an interest in it. And I asked them to share it to whoever they thought might need it. And several of the folks that I sent it to were able to do that. So I see this project and where it's going as a starting point for future conversations, whether they be virtual, in person, whether they be through this same platform of videos and a series, of which I can modify content based on feedback. And I would like to continue this also to just normalize a physician's burnout experience and use tangible coaching strategies to help them reframe the thoughts and the feelings associated with burnout to lead to different results. Basically being well and enjoying yourself in practice. And I would like to continue to discuss strategies, both individual and institutional, to prevent burnout. Thank you very much for attending today. If you have questions for me, please email me. The link to the videos is here on the slide for the Vimeo link. If you go to that Vimeo website and you don't have the number, you can just put my name and search and it should bring up the videos. And I've also linked them on my personal website under the tab Physicians. And I can include these in the chat later after we're done. And this is just juggling all the balls, which is what we do. Thank you very much.